Welcome to OAC's monthly broadcast, our first broadcast of 2022. I'm Christy Kuna.
I'm James Zervios.
We're so happy to be back with you guys in this new year.
2022, I would have thought by now, Christy, that we would have had like hoverboards or something else like that.
Yeah, I think you're sorely mistaken. While we've made some progress in that realm,
We're just not there yet.
We're just not there, but lots of other great progress points, I think, to talk about today. But, it is, I think, winter. One thing I was remembering is we had a membership call last week, and one of our members, Deb, who may be watching right now, it was negative 23 in Minnesota.
Negative 23?
It was. And so here in Florida, we're in the 50s and we're freezing.
But I think Saturday, about Deb, I guess I shouldn't say it. I mean, it's going to be 34 in Florida this Saturday, but
which is a crisis for us.
That is a crisis. Yeah. And negative 23, that would be the end of Florida.
So shout out to Deb for hanging out in that, because that's one thing I actually do see she's online. So there you go, Deb. But we're excited to start this new year off right. The broadcast is a great place to start. And today is all about really hearing about and kind of cultivating all the topics that we want to talk about through this broadcast through the end of the year. We really want to kind of shake up the format a little bit, but be very bold this year, right?
Well, yeah, I think be bold and talk about topics, especially relating to obesity, that often aren't discussed, because I think so often, and we know this, we've been doing this a long time now at OAC, the obesity is often oversimplified. Mm-hmm. And I think that is something that we were trying to reclaim that narrative and to really bring to light some of these bolder, more difficult to talk about topics on this broadcast.
No, absolutely. And I think reclaiming the narrative is a big focal point for us this year. But I do think as we think about these topics, I mean, thinking about talking about obesity, it's sometimes not the easiest topic. It is complex, right? So what we're really focused on this year is to make these topics engaging more than ever, to be thoughtful, thought-provoking. So we're excited about that, and there'll be opportunity for you guys at home to contribute to that. I know some are already doing that already, so excited.
And to bring on subject matter experts on this too.
Yes,
bring
we'll continue to do that.
We've continued. We did that all last year. We're going to continue to do that this year, and really help us dive into these topics.
Yes, and you also might notice we have balloons on the set, and as much as it is because we're celebrating the start to a new year, we have a very exciting announcement that will be coming your way quite soon. So that's what the balloons are for, about YWM 2022 and all the news.
Everybody's been asking about that, so stick with us.
Yeah, but this is an interactive time. If you're joining us for the first time, welcome to our broadcast. We do this every month. But let's stop and say hello to some of our loyal and new followers. So like I said, I already saw that Deb from Baudette, Minnesota, where it's frigid, is there. Thanks, Deb, for joining in.
And we have Diane from Massachusetts and Shelly from Temecula. Shelly, you're always there with us. Thank you very much for joining again.
Actually, Deb chimed in and said it's 19 degrees there. So she definitely has a leg up on us.
Deb, that's too cold. Come to Tampa.
And we have Melinda from Mississippi, and then Mackenzie from Tampa. We know Mackenzie.
And Sherry from Brooklyn, and we have John here as well from Texas.
Awesome. Well, good representation all around. Keep those comments going in the chat. Keep the dialogue going. This is meant to be interactive, more interactive than ever. And
well, you have to chat, because for those of us that have been watching for a while, that's how you get to win one of our exciting giveaways. We have our Stop Weight Bias mugs here. As you can see, our words and actions matter. We're actually going to talk a little bit about how much words matter a little bit later in the show.
That's true. And we
comment
have
in the chat.
Second mug that will be given away. Another from the Stop Weight Bias campaign. Perfect for all this cold weather we're talking about. I think everywhere it's cold. If it's cold here, it's cold everywhere. So keep those comments going in the chat. That's how we'll draw at random at the end of the broadcast for you to be a lucky winner of our fabulous prizes. So I know we have lots to dig into before we get into talking about our main topic today. And we always like to start with letting you guys know what's happening here, even at the start of this new year. It's busy. We always say this, but it's true. But first things first, tomorrow evening, OAC is doing its first OAC Health Talk of the new year tomorrow, and it's on the topic of finding a program that works for you, setting yourself up for 2022, and it's featuring Dr. Holly Lofton, who's an obesity medicine physician and longtime follower, previous board member.
She's fabulous. She's been on the broadcast. Yep. She's just a wealth of knowledge. She's really great.
Yeah, she's fantastic. So she's going to join us tomorrow night, January 27th, 7 o'clock Eastern. So tune in live for that. It's free of charge. It's a great topic to start the new year off. And you can also chat along with fellow attendees of the Health Talk just to kind of keep that conversation going. And then if you do want to always know when these health talks are taking place, which they do this year, we're doing them 6 of them every other month this year. So great topics in store. You're going to want to go to that link that's on your screen. It's also underneath the player here for a link to sign up to get alerts about health talks, so you always know when they're taking place. And of course, previous health talks are all in OAC's resource library that we launched last year. And you can see the link there, but that is a fantastic way to preview the 4 health talks last year were great.
Yeah, so much great information in that resource library. Yeah. And the winter issue of the magazine is here. And it is there. It's also right here.
Everywhere.
It's hot off the presses.
It's very hot.
Just came into the office this week. Should be in your mailbox very, very soon if you're a Premium Access member. If you're not, go to the obesityaction.org website and find out how to become one. But this is an amazing issue. Has a lot of great information, and it talks about telehealth, which became very popular over the past 2 years. And also, oh, look at that, an ad for the OAC Resource Library. Just talking about that. You absolutely want to check out the winter issue, another fabulous issue. And, you know, Christy, I know we just wrapped up the annual survey, and one of the questions in it is about the magazine, or what's your favorite resource of the magazine?
Every year, the magazine dominates as the #1 resource. Folks love getting that to their mailboxes, and you can do that by becoming a member with Premium Access just for $25 a year. It's a great way. You can also access all that content in the library, and some of it's locked for Premium Access members, but all the reason that you might want to consider adding that on for just $25, but it's the #1 benefit and has stayed that way for quite some time now. So, but kudos to your team for putting it together. Yeah. Lots of good stuff happening there. And then thinking about the end of the year, and we talked about how the best is yet to come this year, and that was the theme of our end of the year giving campaign. And I am so excited and so thankful, and want to thank everyone who was part of that, where we set out to have a $10,000 goal to raise by the end of the year, to be able to really get these efforts forward and get our momentum into 2022. And I'm so excited that we crushed that goal. We broke it by more than $3,000. And so we are so excited and thankful to everyone who contributed. Every dollar truly does make a difference. And donations happen all the time, not just the end of the year. So you can always donate at obesityaction.org/donate. And we are a 501c3 charity. All our donations are tax deductible. But of course, it is going to support our operating efforts and how we really make all this work happen.
Yeah, we really do appreciate everybody who was able to donate. We know it's not always an easy time to give, but I think the thank you to everyone who did.
Any
you can
little
still
bit helps.
give right now. TROA update. We talk about TROA a lot on the OAC TV broadcast, and we're so excited to bring you guys some very, very exciting news. Since Thanksgiving, we have picked up 24 additional co-sponsors in the House, bringing the total to 125,
Awesome.
And one in the Senate, bringing the total to 17. TROA, for anyone that's not familiar with it, is very important legislation that would give Medicare and Medicaid recipients access to obesity management services. This is something the OAC has worked on for quite a while now, and we're still working very hard to have it pushed through. And that's where you come in. So if you haven't yet supported TROA or ask your friends or family to do so, you can do so by visiting obesityaction.org/TROA. You can see it right here. And you can also access that link in the description below.
Yeah, and I think that's a strong reminder that efforts for Treat Reduce Obesity Act will continue in 2022. It reminds us of, as much as we've been championing this legislation, that's all the time that has been where folks have not been able to access the care that they need. So that's why that legislation is so critical. Yeah. So I'm happy to see that push forward again in 2022, and we are really hopeful for this year with your help that'll hopefully be possible. So, switching gears a little bit, we also have some excitement on the horizon with Obesity Care Week, this year's Obesity Care Week awareness campaign happening. Your team is so busy at work doing this, so
yes,
give folks a little glimpse on what to expect, because that's just in about a month's time.
I get about a heart palpitation when you say it's in about a month's time, but it is. Obesity Care Week 2022 is literally about 30 days away, right around the corner, February 27th through March 5th. And Obesity Care Week is really that time where the OAC and our partnering organizations such as OMA and TOS, ASMBS, and the Stop Obesity Alliance come together to raise awareness of obesity, treatment, access to care, such as the Treat and Reduce Obesity Act, weight bias, childhood obesity, and so much more. And this is that week that we really elevate these issues, bring national awareness to them, and showcase this. A lot, Christy, a lot of diseases and conditions have like a day, a month, and this is really that time for Obesity Care Week that's so special to what we do to help raise the visibility of it.
Well, and I think the key part of that is the word care, because while obesity awareness in general is super important, really twisting it to thinking about care, and that's what Treat Reduce Obesity Act does, and so much of the work we do is to be able to have folks be able to access that care they need. So I'm so excited about this week because it really elevates that concept that isn't really known to the world. And this campaign, as much as it is, championing what, we do and what you all are watching, you believe in, we want this to go beyond that. It is meant to be a campaign that transcends beyond our community and beyond the industry that we work in. So that is the hope, so that the world can understand the importance of care and how people who have obesity deserve that care and need that care.
Absolutely. And if you're watching right now and you're wondering, well, what can I do? How can I get ready for Obesity Care Week? Well, I'm sure on the February broadcast, we're really going to take a deep dive into what that is going to look like. But right now, you can go to obesitycareweek.org and sign up for the OCW 2022 alerts. You'll sign up for it. You're going to be the first to get all the information on Obesity Care Week and help us take action. The theme for this year is now is the time to act, and that is very true. And we need your help, and we need you to take action. So go to the website, check it out, and sign up for the alerts.
Excellent. Well, I don't know if rounding out our updates here, is it time?
Well, you know what? I don't know, because people have asked for a long time, what's going on with convention? Are you guys doing convention? Where is it going to be? Is it going to be virtual again? Christy, I think that
we owe an explanation.
I think you owe an explanation to the viewers, because I think they're ready.
I think they're ready. Well, get ready, because we are so excited to announce our official plans for OAC's 2022 Your Weight Matters Convention that we know you've been waiting for. And so for the past 10 years, OAC Convention has stood strong as that premier go-to conference that's designed by patients, it's for patients, and it's been responsible for transforming the lives of thousands of individuals who are seeking that quality science-based education, and they want those lasting connections as well that our community ties. So, it's always been an in-person event. So those who follow us know this, but as you know, we've had to go virtual the last 2 years because of COVID. But we took that opportunity to ensure that quality education folks needed was able to continue. So we transitioned to our virtual platform, where we saw tremendous success. I mean, it was, we really didn't know what to expect, but it was unbelievable. And we were able to reach more individuals through that platform than ever before. So what was clear at that time was there's a critical need for accessible, quality education that can reach as many people as possible. But we also recognize that our community, those who rely on getting together, getting connected each year in person, they're ready to be back together in person. That's what they're telling us. So I am so thrilled to announce that OAC is committed to hosting both a virtual and an in-person meeting each year moving forward. So that's 2 unique events offered at different times, and those are designed to meet the needs of all of our diverse community. So I'll tell you when they are. This is the big news. Get ready, because we are going to host YWM 2022 virtual May 14th through the 15th. It's coming, which is going to include an entire weekend packed full of great education, the most sought after presenters. There's going to be a virtual expo hall and some opportunities to connect online with your fellow attendees. And I'm proud to unveil our newly branded in-person meeting, YWM Engage, which is set to take place July 14th through the 16th at the beautiful Westin Lake, Las Vegas. This is in Henderson, Nevada, outside off the strip, so it's kind of a nice retreat-like environment. But our in-person meeting has really been re-envisioned to, of course, keep the health and safety of our attendees the #1 concern. And while this event is going to be different than the virtual meeting, it does promise to be an immersive, hands-on educational experience. And it's also going to allow you the opportunity to make those connections, but also learn to be an active advocate for change. So details are now available on YWMconvention.com, where you can get a glimpse of both events.
Yes, Christy, and you know what? It's already starting in the chat here. We had Diane and Jamie are excited for YWM 2022.
Yes.
Dorothy and Deb are excited that we're doing both events. As Christy said, details are now available at YWMconvention.com. Our convention committees are hard at work right now, putting the finishing touches on the complete details to be released very soon, which includes all of the great topics, the speakers. And the one thing that I know everybody is wondering right now, when does registration open? Well, you're going to find all that information out very soon. You're going to start to hear a lot more about OAC's 2022 convention events, so be sure you're tuned into OAC's channels to get the latest information as it's released, And you can sign up for convention e-news alerts by visiting ywmconvention.com. We're so excited about these events.
Definitely.
And we hope that you are too, which is why we want to make you, which is why we want you to make plans to attend either one or both of the convention events this year, because these are experiences that you definitely don't want to miss. And we know that was a lot of information. If you didn't catch all of it, in just a few minutes, you're going to get an email. If you're connected to OAC and you're subscribed to our alerts, you're going to get an email in your inbox that's going to talk more about convention and give you all of the details. So be on the lookout for that.
So again, real quick, virtual meeting, May 14th through the 15th, one weekend online. And then we have YWM Engage, the in-person meeting, July 14th through the 16th in Las Vegas. We're very excited. I love the chatter already. I'm seeing about how they like that we're doing both events. And honestly, it's because we're trying to really meet the best of both worlds. And we're hopeful that this is going to be the way to do it. So stay tuned for more.
Kudos to you and your team, Christy, because you've led convention really now since the beginning. I think the first one was in 2012 in Dallas, Texas. It was freezing. I remember that. It was freezing in Dallas. And the convention has really grown into something amazing, pivoted with virtual. That grew even more. We had so many people attending, over 2,500 people attending. It's very exciting with this change now and to have two events. So kudos to you and the convention committee.
And the committee, I was going to say, tomorrow night we meet once again to kind of continue these details. The programs are underway. So again, I know you'll hear more about it from us. So just get excited, stay tuned, and just mark those dates on your calendar. And there's some good information on the website to check out as well. So
absolutely. So transitioning to our main topic today, we said at the beginning of the show that we want to get a little bit more bold with our topics on this broadcast. OAC TV broadcast is a really wonderful vehicle for us to talk about these topics and engage with viewers, you all, hearing from you. I've seen here in the chat the different things that everyone wants to learn about and talk more about. But we want to know, what do you want to talk about in 2022? And we want you to tell us. So if you haven't told us in the chat, you can also do so by visiting obesityaction.org/OAC TV. You can see at the bottom of the screen. It's also in the description. And you can tell us what you want to talk about, but keep telling us in the chat, because we're going to talk about these in just a minute. And we're going to make sure we have key opinion leaders on as well.
Absolutely.
I think that's so valuable that, as much as I love bantering about these issues with you, I'm not an expert on all of these, and we need to have that expertise.
No, and today we actually pulled out one topic to focus on today as we kind of get more of these topics in that I think OAC is a good expert on, that we'll talk a little bit more about. But truly, like this, the interactivity in this broadcast is what we really want, and I'm happy to see folks already submitting what it is that they want to hear about. There is a form also that you can go to submit those submissions as well. The link is located under this broadcast, so keep those submissions coming, keep them in the chat. But throughout the years, of course, we have compiled our own list of topics that we know our community cares deeply about. Not just educational. We know educational topics, we've covered so much, but what we're really trying to do is to, like I said, be bolder, but craft this narrative, and how do we create that narrative? And so you guys are going to be the ones to help us do that along the way through this broadcast and ones beyond too. But yes, definitely more experts to come, because while we talk a lot about, issues that we face, lack of access to care and weight bias, there are other controversial topics we want to tackle, such as body positivity. How does it fit into the work we do? And
you talked about the narrative a second ago, about the narrative of obesity, and I think so often when people hear that, they think of that narrative being all about losing weight or weight regain. But the truth is, the obesity narrative is compiled by a lot more than that. As you mentioned, access to care, weight bias, body positivity, recognizing obesity as a disease. I mean, these are all the topics that come up on a daily basis at OAC and things that we focus on, but we want to hear from you. We want to bring experts in to take a deeper dive into these topics and really start to break them down.
Yeah, so a couple that already shared I wanted to mention here. They're fantastic as they're rolling through, so keep them coming. You can also get those giveaways by commenting here. But one that I think is interesting, that Nina wants us to address gaps in physician and patient dialogue about obesity. Absolutely. I think that was not on our list, but that's so true. And how can we make sure that both parties are ready to have the conversation?
Well, this is interesting, right? Because OAC has an entire campaign called the Your Weight Matters campaign at yourweightmatters.org. And the purpose of it is to provide people with the resources to prepare themselves for that conversation of weight with a healthcare provider. But to Nina's point, okay, so OAC has done a great job preparing the one side, But if the provider is not prepared to have the conversation,
Right.
or that provider might not be using the right kind of terminology
Sure.
too, that could
Yeah.
be putting the patient off. And we're going to talk about that in a second.
Absolutely. So keep these coming. And I know Shelley's mentioning that about body positivity. I think it's an important conversation to have it. And I think we have the right folks on to do that. So all these are going to continue on our list and help us, craft this agenda for this year as we really think about how we frame obesity, frame the narrative, and so forth. And we see a lot of also entries around great educational topics, which are great because that'll help us craft some of our health talks that we have coming up through this year as well. So keep them coming.
Yeah, I mean, it's to Shelley's point right here. She said in a follow up to that, she said how she wants to know about body positivity and how that can coexist with losing weight.
Right.
Because I think
Does it help or
oftentimes
hurt our efforts,
and it could be the media lifting one narrative over the other, but that
That'll
can
be
be
a good one.
conflicting at times.
Yes.
So definitely a good topic.
Well, let's dig into one of the topics that is near and dear to our hearts that we champion, that we are, I would say, experts on, thanks to you and your teams leading this effort, is, the importance of people first language. And we talk about language making a difference, language mattering. So we're going to dig into that today and, really showcase the importance, the progress, how much more work we have to do in this realm. But, OAC talks quite a bit about people first language, right? But do we think that folks really know what exactly it means or the impact that it can have and what's, kind of the conversation around that?
Yeah, I think when we talk about people first language, a lot of times people don't even understand necessarily what exactly is that, right? And so I think people first language really came about to not stigmatize people with a disease or a condition. APA Style Guide says that it calls for all publications to put people first, not their disability, and to not label people by their disability. Now, that's people first language in and of itself is not a new concept, but it is a new concept to obesity, right? And so an example of this with people first language is you could look at it as in the past we would have said the woman was affected by obesity instead of the woman was obese. So in the past, we would have used the word obese, and we would have essentially encompassed that person with their disease. Separating it is extremely important because when we keep them together, we know that dehumanizes people.
Right, and I think we've seen two sides to this conversation where, we have, are fortunate to be around a lot of great experts in weight stigma, and they've really shown the scientific evidence behind why this is so important. But we know there are other folks who say, you know what, you're just being too sensitive. You're being too politically correct. It doesn't make a difference to me. But what we're here to do is to really showcase, the value and why language does matter, and really getting obesity to be treated like any other disease state. We talk about obesity as disease, right? But at the end of the day, we cannot relent on the fact that then we need to be treated as such. So, for instance, we use the comparison of if someone has cancer, you don't say, well, they're cancerous. Because there's no empathy behind that. They're not their disease. They are a person who has cancer. And so what we've tried to do is to really adapt that to say, you know what, this is the same for obesity. Obesity is a disease, and so we need to talk about it just as any other disease state does.
And we've come a long way with people first language, especially in certain areas. And one of those areas is the CDC. In fact, the CDC actually cites the Obesity Action Coalition.
This was a
huge win, and I think
for
this was early last year or the year before. But if you look right here on my screen, you can see notes on language and images. CDC says we encourage the use of person-first language and respectful images when discussing obesity and other chronic diseases. For example, say adults with obesity, 20% of children, and so on. Then down here, you can see they actually cite the Obesity Action Coalition. The Obesity Action Coalition has more information. Please see the guidelines for media portrayals of individuals affected by obesity. I am so unbelievably proud of that. I actually had the privilege of creating those guidelines with Dr. Rebecca Poole, who's also been a guest on this show that we've talked to in the past. Excuse me. And the fact that the CDC is using that as a guideline is really, really valuable.
And that is on the page that talks about overweight and obesity, I think, right?
Yes,
So that is, your go-to source. If you're looking for information, the CDC website pops up. That is front and center. And that kind of tells you quite a bit, the fact that language does matter. And I think every disease state faces this, but specific for us, we champion this. And I'm really curious, so this is a great time for this open dialogue to see what do you all think about this concept of people first language. Is it important to you? How has it impacted your health journey? Have you faced negative or even positive results as a result? So please chime in
if you
on
look
that.
here, so Christy Melinda just said the language we use ourselves is very important. I often catch myself talking negatively, and that opens the door for others. I think that's really, really important.
Well, it talks a little bit about, the idea around people first language is so closely rooted and tied to weight bias, right? Implicit bias is certainly something that we've talked quite a bit about. And a lot of folks in our community, have self-admitted that they do have their own implicit bias that just over time, because you become so desensitized to the fact that it is okay just to call somebody obese, right? No big deal. But over time, this is a learning. I mean, even back in the early days, OAC, can fully admit this, is that if you look at our early materials, if you can find them on our website, which we try to change, we use the word obese. I mean, it was in medical charts, it says obese, right? So I think over time, as we learn more and we surround ourselves with the right experts and those who are researching this was a great teachable moment that now becomes a moment that we champion, right?
Yeah, and I think, it's important, Christy, you talked about the shift that OAC has made over time, and we see the success with the CDC using people first language and even citing OAC in that, but we know there's still a lot of work to be done.
Sure,
I think when you look at areas such as healthcare and the media, the word obese just runs rampant. In fact, we talk about this all the time, even with our own education meetings that we do. We just talked about convention 5 minutes ago, but how often when we get presenters' slides for convention, the word obese is in there. And it's interesting because it's not always intentional. In fact, I don't think it's ever intentional. I think it's just a learning moment, a teachable moment.
This awareness is so important about this. And so I think one of the examples is media all the time, aside from, even folks in the industry still are kind of getting accustomed to this, but media, we spend a lot of time, and I know our social media warriors out there do this every day, where they see stories, and not only do they comment on the imagery, which is a whole nother conversation that we could have probably on another broadcast, but the language used, we have so many members out there who are making those teachable moments happen on social media when they see media outlets putting forth these messages. And so I love seeing that, because that is how the fire is going to catch on. So how do folks combat this, or how do they do this in a way that it's not accusatory? Because we truly don't believe that people do this with ill will. I think they just don't know and understand. So how do we move beyond that?
I think it's a great way. And in fact, I'm just, glancing at the chat here, there's so much consensus, right? So Melinda, Diane, Mary, everybody is on this page of the importance of people first language. And if you're watching right now and you're hearing us say that, when we say, well, you would say the person with obesity or affected by obesity, if you've never said that before, that can feel awkward. It can sound awkward. And you might want to learn more about people first language. And there really is a great way to educate yourself, because the OAC has a great resource on the OAC's website. You can see it, a little screenshot of it down there at the bottom of the page. It is available for download on the OAC site. Check the link in the description to download it. And this is a great people first language one-pager, as we refer to it internally here, that describes people first language, the importance of using it, examples of how to use it, and really help us. So if you see an example, you asked the question, you said, so if somebody sees this today, on social media or in a news article, what can you do? A lot of times I read a news article, and right at the top it has the reporter's name. And if you click on it, you can send an email to the reporter. You could send an email to the reporter and give them the link to the OAC's People First Language one-pager, and help educate them and say, hey, you really should update your language, because you don't do this with any other disease. So why do you do it with obesity?
Yeah, and it's a great tip, and it's not just has to be James from the OAC, because you kind of speak on our behalf, but these are, anybody can be doing these really what we would call simple actions that make a strong impact, because we have seen such great success and progress with even folks in the media writing you back and saying, I'm so sorry, I did not even realize, helpful to know in the future. So I think having that one pager is a great way to get yourself educated, and then that's when you become the advocate for change, which is what we champion all the time. But I'm encouraged by the conversation. It seems there is consensus. If there isn't, I'm curious if someone has an alternate view on this. We'd love to chat about it. But Mary does say that she finds it very important to have people first language. It's important not to carry a label before you even open your mouth to talk. Yes. And, the look, the language, it's the all over treatment of it. And so I think that's when we talk about, the complexity of obesity and these topics, which is why it's so important to have these conversations with you guys viewing, because it really does help craft this overall narrative and craft the things we're going to champion. And And with People First Language, that is not just a US thing. This has become a global initiative. I think it's worthy
Yes.
to say that.
Oh, yeah.
We work with a lot of fellow patient organizations from other countries, all over, and they have their own campaigns. And actually, one of our strongest partners, ECPO, actually started out their whole organization champion People First Language in Europe. And so this is not, a US only issue. I mean, this is a global issue. And I'm just really happy that OAC has really been on the front lines of this. And we share our resources with all these types of partners. Likewise, they give us information as well. And so I think that it's a wonderful way to really showcase the power behind our collective voices. And this is a great issue to speak on.
People First Language, to adopt it is a very easy thing. And it makes a big difference, right? I think this kind of, when you were talking a second ago about the global movement around it, I don't know why, but this popped up into my head, was the OAC's beliefs and demands, which are right on our homepage. And we talk about being treated with dignity, respect, all of that. And that's interwoven through everything that we do. You're going to see that in our convention. You're going to hear about that in a month with Obesity Care Week. So again, something very easy to do. Check out the link in the description. Learn more about People First Language, because it is very, very important. And by you taking that step, you are helping us change. You're helping us drive those actions that we need you to do.
Yes, which is really the whole goal in all the efforts that we do. So we've enjoyed having this dialogue with you. You guys are welcome to keep it up. We are coming towards the end of the broadcast, which is pretty remarkable. I feel like that went by so fast.
That was quick.
Good excitement and news, but that's just a little bit of a glimpse at the types of topics that we want to cover this year. So please be sure to fill out that form, and even in the chat as well, to tell us those other topics. We already had some good submissions here, but we really want to start thinking more and to be able to help craft this narrative so that we can make that more significant impact. Because, imagine if there was a world where, our language was really perfected and people were treated not as a disease, but as the person whom they are who has a disease. There's a big difference there. So definitely give us those submissions as we craft more of these broadcasts. We really, really enjoy being able to connect with you in this way.
Well, and all of this great chatter, Christy, has definitely led us to the moment that we know everybody loves, which is...
It's not about the giveaways.
It's not?
No.
Oh.
No.
My bad. But it is giveaway time.
It is.
So
I do think it's about the giveaways. But
with that, our first OAC Stop Weight Bias mug, which, again, to the point we were talking about, our words and actions matter. I know you probably can't zoom, but when it comes in your mailbox, you can see it, is going to go out to Diane Novick. So, Diane, congratulations. This will be coming your way very soon.
Congratulations, Diane. And our second lucky winner of our other Stop Weight Bias mug is equality, compassion, kindness, empathy, dignity, respect. All words we can agree on. Goes to Melinda Ownby. So congratulations, Melinda and Diane, for your prizes. Thanks for commenting, but thanks to everyone who was commenting along the way. One good thing to encourage is that because we're going to shake things up, because we want to be bold, invite others to join this broadcast.
Yes.
You also need to subscribe. Everybody viewing, make sure you're subscribed to our YouTube channel, because we do this stuff on a regular basis, but inviting others to the conversation is crucial.
Mm-hmm.
Yep.
And you're going to want to join us tomorrow evening at 7 p.m. for our next health talk with Dr. Holly Lofton. Again, She is fabulous. Very, very exciting to hear what Dr. Lofton's going to talk about. Find a program that works for you and setting yourself up for 2022. We know this is such an interesting time with a lot of ads hitting everybody in January when it comes to
She touches on all
health.
those things too, yes.
Check it out tomorrow night, 7 p.m. Eastern, OAC's YouTube channel.
And a couple other strong reminders, of course, you saw the link before to get those submissions in to help us craft these thought-provoking topics that you want to see, obesityaction.org/OACTV. And you have Obesity Care Week coming up, so we want to make sure that those alerts are going to come your way to sign up for those at obesitycareweek.org. Yes. So we've got that covered. But otherwise, I think this is the time. This is the time to stay connected. We are really hitting the ground running in 2022, it's safe to say. So lots in store, so make sure you're connected to us.
Yes. Definitely go to obesityaction.org/connect. Follow us on social media. Subscribe to our YouTube channel. All of these links are in the description, so check out each one of them. Christy, again, this was the start of season 3.
Oh, yeah.
I think it's going to be one heck of a year. I mean, we covered so much ground today. We got 2 events coming up for convention. We got Obesity Care Week coming up in a month. We got health talks throughout the year. It's going to be a busy year.
Lots of work on the membership fronts happening too. Some excitement to come. So yeah, all the reason to stay tuned. But thank you guys for spending your afternoon, early morning, or maybe evening, wherever you are with us. We so enjoy this. We'll see you next month for another OAC TV broadcast. But for now, stay warm wherever you are.
Thank you very much.
We'll see you next time.
Take care.
Thanks.